Kegels are essentially holy grail for pelvic floor health, but are they the best exercises, and should you even be doing them? Hi, I'm Dr. Shaki from Core Pelvic Floor Therapy right here in Irvine, Orange County. I'm going to tell you all about Kegels in this video. I'm going to tell you, or let's discuss, if Kegels is the right thing to do. What is nature's alternative to Kegels? Is it possible for you to overdo Kegels? How to know if you're doing the exercises correctly? And should you even consider doing Kegels at all? This video is intended for you to understand how we should naturally approach addressing the health of the muscles inside of the pelvis, both relaxation and strengthening of those muscles. If you have not subscribed to the channel, please make sure that you do. I would love to hear your comments once you watch this whole video, and also make sure that you turn on the bell notification for the notification bell.
Notification bell? Yeah, I think so. Notification bell.
The notification bell. Make sure that you turn on the notification bell so all future videos that I do, you get notified. So let's begin. First of all, what is the purpose of Kegels? Kegel exercise, well, it's actually some medical doctor's last name. That's what Kegels is. And it was intended to try to teach people how to relax the muscles inside the pelvis. Well, the sad thing about it is most people don't even know if they're doing it correctly, and most often they don't do it correctly. So when they are taught how to do it, even the teaching, in my opinion, is incorrect and can be problematic. In fact, there are many people that report to me that when they do their Kegels, they get more pain. So when you're told to hold your urine as you're urinating and let go to really connect to those muscles, I'm totally against it, because I think that causes issues with the nerve function as well, and it doesn't really allow you to connect. Instead of trying to come up with a human version of what nature does, it only makes sense to see how nature relaxes these muscles inside the pelvis. So the way we actually relax those muscles is through biological breathing. Biological breathing is the kind of breathing that we learn by studying human babies. What we see is that they do not breathe like pushing their chest out. Instead, as the breathing happens and we're breathing in through the nose and we're breathing out through the nose, the lungs get filled up, the dome-shaped diaphragm gets pushed down this elevator shaft, and it pushes the sides out. So if you place your fingers on the front of your waistline and your thumbs on the back side of your sides, and as you breathe in through your nose, by the way, make sure that you're not slouching, you're upright, sitting on your sit bone, and you breathe in through your nose, and you want to feel the inside of you pushing these fingers, not pushing them this way. That's not going to happen. This is breathing. It needs to be gentle. It presses against the fingertips and your thumbs as you're breathing in. So it's going outward. Most of your focus should be on the outward expansion of your sides, because when you do that, you don't push your front more than your back. It's a circumferential expansion of your trunk, which is highly effective and very much relaxing these muscles on the inside. The process of breathing out is not the collapse of everything because you're breathing out. It's a contraction of the same muscles together that allow that expiration, that breathing out process. So as you do this, follow in your head the image of this whole um, cylinder that you have created inside of you to now the bottom portion gently pressing to push the air up to reverse the process. This is what we do naturally in place of what Dr. Kegel recommended. So I'm personally against Kegels because I think most people do them wrong, and it doesn't really allow you to connect with all these muscles here. So if you have it tight inside of your pelvis, that whole connection by doing the Kegel is going to make the matters worse because you don't even know if you're doing it correctly, and you can actually damage things more than you realize. What we want to know is, what does a tension, when there is tension on the muscles on the inside, what does that feel like? What are some of the signs? Some of those signs are things like pain during sex, difficulty urinating or emptying the bladder. It can be constipation. It can be feeling of like you're sitting on a golf ball, pain in your groin, pushing your pee out, like even pushing gas out, believe it or not, burning in the perineum, or basically a tug of war between the front and the back. So people tell me it feels like there is a war. There's so much tension and burning in my perineum and around the anus, and there's like a lot of that is happening. You can also have issues in the inner thigh. So you feel tension inside your inner thigh. So these are some of the signs of overactive muscles inside of the pelvis that you may have or you've been told to do Kegels for. So just as I mentioned, we want to go with how this body was created to receive relaxation of these muscles. This is kind of like planting a seed. If you have a fertile ground, the seed that you're planting has a much better chance of flourishing and becoming whatever flower it is that you wish to have. So if you provide the ground, your body parts know exactly what they need to do. They would love to do it, but they're not getting a chance. So that is really how my approach is for pelvic floor dysfunction treatment, because instead of trying to rig something new, I'm just going to go with what has already worked, because we all started from helpless infants. We all became running toddlers without any bands, weights, anyone telling us how to do. So we're hardwired to follow a very specific progression of movement. This is how our very unstable body became stable. That includes pelvic stability. So if something has worked over and over across the board for every walking human being, why am I coming up with a new version of how to do things? I'm going to look at the same progression of movements and methodology in movement and try to see, how does this individual compare to this manual of movement? This is where the issue lies, and this is how I can use the same natural progression to help fix the problem, if that makes sense. So what to do if you are used to overdoing the Kegels? Like I said, biological breathing is how you condition these muscles naturally. At a frequency of every breath, these muscles, every breath done correctly, the muscles inside of your pelvis relax, the same muscles learn to contract together. So how do we fix it? You stop doing Kegels and you learn how to do biological breathing. This is how you address the dysfunction using the biological breathing, and then you go in and try to fix the dysfunction. During this whole process of you having to change your methodology in movement, your body parts have learned to dance differently. So to make those corrections, because we went to and we did the biological breathing to address the tonicity. Now the body parts, the reason why these got tight need to be addressed. That means we're going to use the right exercises. The right exercises are the developmental exercises, the same things that got us from helpless infants to running toddlers. That is what we're hardwired to do. So that's the manual of movement. I'm going to use the same exercises to see how does this individual with this problem compare to this methodology. The most important factor is for you, the owner of this body, to understand what was missing. This is not just for your pelvic floor or for your pelvis. This is for your overall body. So in addressing the pelvic instability the right way, you get to understand proper movement for every part of your body, because just like everyone knows, everything is related. Everything is connected. So I use developmental kinesiology movements like dynamic neuromuscular stabilization to not only bring stability into the area, but to show my patients what right looks like, what their tendencies are, and what to replace the wrong with. How do you know if you're doing it correctly? Well, you start seeing the result. With biological breathing, you start noticing that you breathe better and you have less tendency to clench that butt or that perineum, and you start seeing some positive changes. This is something that happens over a course of time. It doesn't happen overnight, but it's definitely highly effective and allows a lot of people get rid of a lot of their dysfunctions, pelvis or not. Thank you for watching, and until next time, take care.